1. Breaking. Trump admin shares Medicaid recipients' data with IC. What you need to know. 2. Trump admin to share Medicaid enrollees' personal info with ICE. 3. IC access to Medicaid records. What it means for immigrants in the U.S. 1. Breaking. Trump admin shares Medicaid recipients' data with IC. What you need to know. In a bold move, the Trump administration has granted Immigration and Customs Enforcement, IC, access to the personal data of America's 79 million Medicaid recipients, including sensitive details such as home addresses and ethnicities. This unprecedented step, detailed in a recent agreement obtained by the Associated Press, aims to track down immigrants potentially residing unlawfully in the United States. The document, signed on Monday between the Centers for Medicare and Medicaid Services, CMS, and the Department of Homeland Security, DHS, has not been publicly announced, leaving many in the dark about this sweeping policy change. But here's where it gets controversial. This agreement signifies a significant escalation in the Trump administration's immigration crackdown, which has consistently pushed legal boundaries in its pursuit of arresting approximately 3,000 individuals daily. Lawmakers and certain CMS officials have already challenged the legality of granting deportation officials access to specific states' Medicaid enrollee data, a move initially reported by the AP last month and justified by Health and Human Services, HHS, officials as a measure to identify improperly enrolled individuals. And this is the part most people miss. The data sharing pact explicitly outlines ICE's intentions with the health data. ICE will utilize the CMS data to enable IC to obtain identity and location information on aliens identified by IC. Such revelations, even if not immediately acted upon, could instill widespread fear among individuals seeking emergency medical assistance for themselves or their dependents. Previous measures to curb illegal immigration have transformed schools, churches, courthouses, and other common venues into potential hotspots of danger for immigrants and even U.S. citizens wary of becoming entangled in raids. HHS spokesperson Andrew Nixon declined to comment on the recent agreement, leaving uncertainty regarding whether DHS has accessed the information. However, in a statement, DHS Representative Tricia McLaughlin stated that both agencies are exploring an initiative to guarantee that unauthorized aliens are not benefiting from Medicaid services intended for law-abiding Americans. The database will expose to ICE officials a wealth of personal information, including names, addresses, birth dates, ethnic and racial backgrounds, and social security numbers for all Medicaid enrollees. This state and federally funded program offers healthcare coverage for the nation's most impoverished populations, encompassing millions of children. The agreement stipulates that ICE cannot download the data but can access it during specific hours, 9 a.m. to 5 p.m., Monday through Friday, until September 9th. They are attempting to transform us into immigration officers, confided a CMS official who requested anonymity due to the lack of authorization to speak to the media. Non-citizens residing in the U.S. without legal status, along with some lawfully present immigrants, are prohibited from enrolling in the Medicaid program, which provides near-free health services. Medicaid is a joint venture between states and the federal government, but federal law mandates that all states offer emergency Medicaid, a temporary coverage exclusively for life-saving services in emergency rooms, to everyone, regardless of citizenship status. Emergency Medicaid is frequently utilized by immigrants, both lawfully present and otherwise. It's unfathomable that CMS would breach the trust of Medicaid enrollees in such a manner, remarked Hannah Catch, a former CMS advisor during the Biden administration. Historically, enrollees' personally identifiable information has not been shared externally unless for law enforcement purposes to probe waste, fraud, or abuse within the program. Last month, Trump officials demanded that federal health agency staff disclose personally identifiable information on millions of Medicaid enrollees from 7 states, permitting non-U.S. citizens to join their comprehensive Medicaid programs. These programs were launched under the Biden administration, with states vowing not to charge the federal government for covering the health care expenses of those immigrants. All participating states, California, New York, Washington, Oregon, Illinois, Minnesota, and Colorado, are governed by Democrats. The data exchange with DHS officials sparked widespread outrage from legislators and governors alike. Consequently, 20 states have filed lawsuits alleging violations of federal health privacy laws. Previously, CMS officials had unsuccessfully resisted the data sharing, which is now central to the ongoing legal battles. On Monday, CMS officials were once again deliberating whether to grant DHS access, citing concerns over the litigation. In an urgent email thread titled, "Hold DHS Access. Urgent," CMS Chief Legal Officer Rujul H. Desai suggested first consulting the Department of Justice to request a direct pause from the White House on the information sharing. The following day, HHS lawyer Lena Amantiu confirmed that the Justice Department was at ease with CMS proceeding with providing DHS access. Dozens of congressional members, including Democratic Senator Adam Schiff of California, penned letters last month to DHS and HHS officials urging an immediate halt to the data sharing. The extensive transfer of personal data belonging to millions of Medicaid recipients should raise alarms for every American. This egregious breach of our privacy laws must be stopped forthwith. It will inflict harm across the nation and discourage citizens from accessing vital health care, Schiff responded to the AP's account of the newly expanded agreement. This will only exacerbate the situation, causing more individuals to forego critical medical attention due to fear of deportation or other repercussions. The new agreement clarifies that DHS will utilize the data to pinpoint, for deportation purposes, individuals residing in the country unlawfully. However, HHS officials have continuously claimed that the primary objective is cost-saving, to investigate whether non-U.S. citizens are inappropriately accessing Medicaid benefits. HHS acted entirely within its legal authority and in strict adherence to all pertinent laws to ensure that Medicaid benefits are reserved for those lawfully entitled to receive them, Nixon stated in response to the lawsuits last month. 2. Trump admin to share Medicaid enrollees' personal info with ICE. Imagine a scenario where seeking essential medical care could lead to deportation. This is the stark reality facing millions of immigrants as the Trump administration moves to share the personal information of nearly 79 million Medicaid enrollees with federal immigration authorities. But here's where it gets controversial. While the stated goal is to prevent undocumented immigrants from accessing Medicaid benefits, the policy raises serious concerns about privacy, trust in healthcare systems, and the potential chilling effect on vulnerable populations seeking life-saving care. In a recent statement to NBC News, Department of Homeland Security spokesperson Tricia McLaughlin framed the data-sharing agreement between her agency and the Centers for Medicare and Medicaid Services as a necessary measure to enforce immigration laws. However, critics argue that this move could disproportionately impact lawfully present immigrants and even U.S. citizens, as the database includes sensitive details such as home addresses, ethnicities, and social security numbers. The Associated Press broke the story, revealing that Immigration and Customs Enforcement, ICE, will gain access to this trove of information, albeit with restrictions. They can only review the database during business hours until September 9th and cannot download the data. And this is the part most people miss. While undocumented immigrants and certain lawfully present immigrants are already barred from enrolling in Medicaid, federal law mandates that all states provide emergency Medicaid coverage to anyone, regardless of immigration status. This temporary coverage is strictly for life-saving emergency services, yet the new policy blurs the line between healthcare access and immigration enforcement, potentially deterring people from seeking critical care. California Attorney General Rob Bonta has taken swift action, seeking a court order to block the data-sharing initiative. The idea that individuals might avoid essential medical care out of fear of deportation is deeply troubling, Bonta stated. This administration's attempt to weaponize private health data for mass deportation cannot stand. California is not alone in its opposition. Earlier this month, it joined 18 other states, including New York and Oregon, in suing the Trump administration over this decision. A hearing is set for August 7th, marking a critical juncture in this contentious battle. Here's the bigger question. Is this policy a legitimate effort to uphold immigration laws, or does it cross a dangerous line by compromising the privacy and health of millions? As the debate unfolds, one thing is clear. The intersection of healthcare and immigration policy has never been more fraught. What do you think? Is this a necessary measure, or does it go too far? Share your thoughts in the comments. This is a conversation that needs your voice. 3. IC access to Medicaid records. What it means for immigrants in the U.S. A chilling development is unfolding in the realm of immigration policy, one that could cast a dark shadow over the lives of millions of immigrants in the United States. The Trump administration has embarked on a controversial initiative that involves granting Immigration and Customs Enforcement, IC, unprecedented access to Medicaid records, a move that has sparked widespread alarm and concern among immigrant communities across California and beyond. In a move that has largely flown under the radar, the Centers for Medicare and Medicaid Services, CMS, and the Department of Homeland Security, DHS, have inked a deal that effectively hands over the personal details of roughly 79 million Medicaid enrollees to IC officials. This treasure trove of private information, which includes sensitive data such as home addresses, social security numbers, and ethnic backgrounds, provides IC with a powerful tool to track down and potentially deport individuals suspected of residing in the country without proper documentation. The agreement, recently obtained by the Associated Press, reveals that IC will utilize the CMS data to obtain identity and location information on aliens identified by IC. This development marks a significant escalation in the Trump administration's efforts to clamp down on illegal immigration, fulfilling its pledge to apprehend thousands of undocumented immigrants daily. However, the legality of this move is far from clear, and it is likely to face numerous legal challenges. The revelation that the Trump administration directed the CMS last month to share personal information on Medicaid enrollees, including non-U.S. citizens participating in state-funded programs in California, Illinois, Washington, and Washington, D.C., has set off alarm bells among critics. These states operate state-funded Medicaid programs specifically for immigrants who are otherwise ineligible for federal Medicaid and had pledged not to bill the federal government for these services. California Senators Alex Padilla and Adam Schiff were quick to express their concerns regarding potential breaches of federal privacy laws, as detailed in their letter. https://www.padillaSC.gov/newsroom/press-releases/Padilla Schiff raised concerns over transfer of health data for immigration raids, demand end to sharing of personal data. To U.S. Health and Human Services Secretary Robert F. Kennedy Jr., DHS Secretary Kristi Noem, and CMS Administrator Mehmet Oz. They argued that the administration's actions not only raise ethical questions, but also contradict long-standing policies and may violate federal law. Padilla and Schiff voiced their deep unease about the administration's intention to misuse individuals' private health information for enforcement actions targeting lawful non-citizens and mixed-status families. They condemned the decision by the Department of Health and Human Services, HHS, to share confidential health data with DHS as a significant departure from established federal privacy protections, warning that this should concern all Americans. When asked about the matter, DHS spokesperson Tricia McLaughlin sidestepped questions regarding whether immigration officials are currently accessing the personal Medicaid data and how they intend to use it. Instead, she stated that President Trump had consistently vowed to protect Medicaid for eligible beneficiaries. She justified the initiative by asserting that after Joe Biden allegedly allowed millions of illegal aliens into the country, CMS and DHS are exploring ways to ensure that illegal immigrants are not benefiting from Medicaid funds intended for law-abiding American citizens. Undocumented immigrants are barred from enrolling in Medicaid, a joint federal and state program designed to assist low-income individuals with medical expenses. The program also imposes restrictions on benefits for other legally present immigrants, requiring some to wait before they can receive coverage. However, federal law mandates that states provide emergency Medicaid, which covers life-saving services in emergency rooms for everyone, including non-U.S. citizens. According to a 2024 Congressional Budget Office report, https://www.cbo.gov/publication/60805, between 2017 and 2023, approximately $27 billion was allocated for emergency Medicaid services for non-citizens. This figure represents less than 1% of the total Medicaid spending during that time frame. Despite this, Trump and other federal leaders have advocated for reduced Medicaid spending, claiming that undocumented immigrants have exploited the program. Hannah Katch, a CMS advisor during the Biden administration and a former employee of California Medicaid, expressed her dismay at the Trump administration's plan to hand over Medicaid data, calling it a staggering breach of trust. Katch explained that the data transferred from states to CMS is subject to specific protections and requirements, both statutorily and by convention. She emphasized that sharing Medicaid enrollees information outside the agency would have a catastrophic impact on those who rely on emergency Medicaid for critical care. Katch highlighted the cruelty of instilling fear in people seeking medical attention during emergencies or for their children, describing it as an abhorrent action. Elizabeth Laird, the Director of Equity in Civic Technology at the Center for Democracy and Technology, echoed Katch's sentiments, stating that the sharing of such sensitive healthcare data would further erode public trust in the government. Laird accused the administration of betraying the trust of nearly 80 million individuals by turning over their healthcare data to IC. She criticized the administration's claim of using the information to combat fraud as a deceptive ploy to advance its agenda of deporting millions of people. Notably, over 90% of entitlement fraud is committed by U.S. citizens, highlighting the disingenuous nature of sharing this information with IC. This isn't the first time the Trump administration has sought to share personal information across departments. In May, the Department of Agriculture instructed https://www.gov/about/USDA/news/press releases// Secretary Rollins requires states provide records, SNAP benefits, ensure lawful use federal funds, states to disclose data on recipients of SNAP food benefits. Last month, the California Medical Association warned that the administration's sharing of Medicaid data could jeopardize nearly 15 million patients and their families statewide. Dr. Renee Bravo, the president-elect of the California Medical Association, emphasized that their primary responsibility is to protect patients and provide the highest quality health care possible. He expressed concern that patients often seek medical care during vulnerable moments in their lives, relying on the safety and confidentiality of the healthcare system. Bravo stressed that the administration's actions undermine this fundamental trust. Orange County's Office of Immigrant and Refugee Affairs alerted the public last month about the CMS directive to transfer personal information of Medicaid enrollees, including non-citizens, to DHS. Jose Serrano, the director of Orange County's Office of Immigrant and Refugee Affairs, noted that while certain information about benefit recipients has historically been shared with the state for research, funding, and eligibility purposes, the current situation is markedly different. Serrano observed that the information is now being weaponized against individuals, particularly immigrants. This situation has already triggered anxiety among immigrant populations in Orange County, according to Serrano. Some individuals have reached out to the agency, inquiring about the possibility of withdrawing from programs or changing their addresses out of fear of being targeted by immigration officials. Serrano pointed out that immigrants contribute significantly more to their communities and the economy than they receive, making it regrettable that their medical information is being used against the very families that support their communities through annual tax payments.